And thank you for staying with us here in the 5 o'clock hour. I'm Alex Giles.
And I'm Molly Grantham. Our team coverage of day one of the vaccine rollout as a top story here at 5:30. These images, they are worth showing again, Alex. The COVID-19 vaccine is now at Atrium Health in Charlotte. Atrium says it is among the first hospital in the nation, one of the first, to receive these potentially life-saving shipments. And these are where the first doses are going. As we've told you, frontline healthcare workers, most who work in direct contact with COVID-19 patients, are the first to receive the vaccinations. Many say they are both relieved and hopeful. It's a crucial first step to bring this pandemic to an end. One of those healthcare workers is Dr. Katie Passaretti with Atrium Health. This morning, she became the first person in North Carolina to receive the vaccine. Just last week, she spoke with WBTV anchor Jamie Bull about her anticipation for the vaccine to finally be approved. Take a listen.
I'm super excited about the vaccine coming out because I really don't see us getting back to a sense of normalcy without the public, kind of a large chunk of the community getting vaccinated.
Yeah, it is a big day. You may be wondering what happens next. Are side effects expected? Who is next in line? WBTV's Chandler Morgan gives us an update now on how Dr. Passaretti is doing and what you might expect when it is time for you to get your shot. Chandler is live. A very exciting day, Chandler.
Molly, it is, and that's something that immediately came out of the mouth of Dr. Katie Passaretti when she received her vaccine today. She says she is excited to be leading this group of people getting their first dose of the COVID-19 vaccine today.
So I just got my first COVID vaccine.
That's Dr. Katie Passaretti. She's the first person in North Carolina to be vaccinated for COVID-19.
Just a moment of hope, a moment of potential for change of the course that we're on with the pandemic right now.
Passaretti is Atrium Health's medical director of infection prevention.
So Dr. Passaretti, as an infectious disease doctor, is one of those physicians who's on the front lines taking care of those patients.
Chief Medical Officer of the Metro Division at Atrium Health, Dr. Gary Little, says it's the frontline healthcare workers that are next in line to get doses of its first shipment of the vaccine.
People who you would think that should be first in line. It's our team, providers, nurses who work in our nursing homes. It's the people who work in our emergency departments.
As the first doses of the COVID-19 vaccine roll out,
I feel perfectly fine. I've had no issues with the vaccine.
Just as getting any other vaccine, Dr. Little says those who receive their first dose could experience mild side effects in the days to come.
Mild headache, muscle aches. Some might get also a low-grade fever. Typically, those will happen within a day or two of receiving the vaccine. And those symptoms usually resolve within 48, no longer than 72 hours after the vaccine.
And I asked Dr. Little today if Atrium Health is requiring those staffers who are administering the vaccine to be vaccinated themselves. He says at this time they're strongly recommending it. Reporting live in Charlotte, Chandler Morgan, WBTV on your side.
It is just a sight to see. We've been talking about it for months. Chandler Morgan live tonight. Thank you.